Okay. So, what is the tissue? Hmm? Cardiac muscles. Yes. Cardiac muscles. At low magnification, what you can say? Which changes? Not some. It's visible very well. What do you see? Which changes? Giant cells. Color. Color.
Darkly pink.
It is blood. Yes. So we can find diabetes, process of diabetes means leakage of the RBCs out of the blood vessel, hyperemia of the blood vessels which are situated in the myocardium. If there is hyperemia, we can say that there is a process of inflammation. Let's look at the cells. Myocardial cells. At low magnification, it's already visible. What we can say? Some purple dots infiltrate area, yes? And we can find the cardiac myocytes, which are swollen and eosinophilic. Yes or no? What are you sitting? And don't speak with me. Let's look. So, process in the cardiac myocytes, process of karyolysis. Yeah? Karyolysis. We don't see nucleus, but still outlines of the cells are maintained. Cell becomes more eosinophilic. Cells which infiltrate area of the dead, means dead cells. Yes, you understood. This is a necrotic cell, necrotic cardiac myocyte. Area which is occupied, infiltrated by cells which are called as inflammatory cells. What's the type of inflammatory cells? U-shape appearance, U-shape of which cell? Neutrophil. Acute inflammation. Yes, here. Coagulative necrosis. We can find acute inflammation. Polymorphonuclear infiltration. Polymorphic cells. Neutrophils. You remember, yes? Is also known as polymorphic infiltration. What else? And also we can see process of diabetes, leakage of the material of the blood RBCs, leakage from lumen of the blood vessel out of the blood vessel in the extravascular region by passive process due to permeability of blood capillaries. What's the time of myocardial infarction? Time. Which time? After the infarction. After the death. Which time?
3 to 7.
Dishan, you told us. Time.
Time.
Yes.
After 24 to 48 hours.
24 to 48 hours. Understood? Continue. Next stage. Next stage. Very smart students, mixed slides, both slides. So again, this is heart, myocardium. What you can see? Where? Blood. Arrangement. Circle. In circle. Yes? What does it mean, circle? What? How do you think? What is circle? Circle inside blood. What does it mean? Нет. Circle. Normal circle. Tube. Yes? Tube. Inside blood. What is this? Tube which has blood. It is blood vessel. Means, what about thickness of the wall of blood vessel here? Wall of blood vessel is thick or thin? Very thin, only endothelium here, yes? Inside blood, hyperemic, да? But here area of the some cardiac myocytes, да? But this area shows us which tissue? Looks like subendothelium tissue. It looks like which tissue? But elongated nucleus of the cells branched, elongated. Between them, what is this? Fibers and extracellular matrix. What is this? It is histology, my dear students. Connective tissue. What is this? In the myocardium, we can see a lot of small blood vessels with very thin wall filled by blood and surrounded by connective tissue. What is this? Surrounded by fibroblasts and fibers. Granulation tissue. Time of myocardial infarction.
3 to 7 days.
Great. Understand? Again, heart, да? Muscle. But you can see area of the muscle, да? And this area is lightly stained, да? Yes? Different? Do you see differences? Partial. Sure? Come on, sure.
And there are no phagocytes.
There are no what?
Uh,
Again, what do you see? What is this? Cardiac myocyte. Yes, cardiac myocyte. And this area? Fibrous tissue. Yes, fibrous tissue. Scott, what can you say about cardiac myocytes? Near the scar, cardiac myocytes, what does change in the cardiac myocytes? Size. Size. Yes, they are increased in size. Near the scar, we can see hypertrophy of the cardiac myocytes. What time? When scar formation?
After months, 3
After
months.
months, 1 to 3 months. Yes, it is cardiosclerosis, post-infarcted cardiosclerosis. Connective tissue replaces the place of the myocardium due to necrosis of myocardium, and the remaining near-lying cardiac myocytes become larger, undergo hypertrophy. Understood? Difficult? No. Yes? It's not difficult. Yes or no? Krutik, difficult? Again, myocardium, yes. But what is here? You can see swelling, yeah? Edema. Edema, yes, present. I mean spaces between cardiac myocytes, bundles, or between cells, spaces like you see. And all spaces here infiltrated by inflammatory cells, yes? Different inflammatory cells. So, some cells of cardiac myocytes undergo pycnosis, karyorrhexis, karyolysis. Some cells are alive with nucleus in cytoplasm. Here we can see infiltration by inflammatory cells. This is separated, this pus. But it's not like edema, that we can see fluid, spaces between cells, yes? Pus, what is this? This fluid, which has the dead cells, alive, dying, death, neutrophils, alive, dying, death, cardiac myocytes for the myocardium, and exudate. Exudate, what is this? This plasma, which is rich in plasma proteins, which leaks out from the blood vessels during process of inflammation. It is separative myocarditis. Understood? Pus formation. That's all.